welcome. I'm Karen Marsdale, and I'm on staff at the Greater Reading Chamber Alliance. And we're here for another segment of our Member Spotlight, and I'm thrilled to have someone whom I've known for many, many years, Dr. Kulp. Dr. Donna Kulp is a chiropractor in our area and has been in practice since 1992.
Correct.
So, my goodness, that is a wonderful legacy. And so we're going to talk a little bit today about the practice, about some of the philosophies that you believe in and that you so successfully practice. And I've been to the practice, and she is one who's very well known in our community. So I'm going to start by, and one of the things that our comments share about you is that you like to use a whole person approach when taking care of your patients. And I think people like that idea. They don't often get it with their perhaps with their physician. Because there's just not that sort of thought process. So let's talk about that.
Okay. Well, one of the things we like to do, Karen, is just really ask a lot of questions. I mean, healthcare starts from the ground up. Chiropractic talks about treating people from the inside out, top down. We're looking at the whole body. So people come in with a headache. A headache could be a neck issue. It could be an allergy.
Right.
It could be a tumor. It could be hypertension. So you could have a lot of reasons for a headache. So our biggest thing is to try to find out why you have the headache. So if we don't ask enough questions and we just shoot right to treating your neck, we may miss the big picture. So not everybody becomes a patient for some reason or another. One of our biggest things is people come in with hypertension, and we'll have to send them out to get it lowered before we can adjust them because it's a risk factor.
I did not know that.
Yes.
Interesting.
So we will look at just their diet. I'll ask questions about what do they eat, do they exercise, and in the history taking, which takes about 30 minutes to get a good thorough history, and then they'll transform and they'll go over and have a physical examination, and we'll start gathering pieces. I always say the first thing we do is decide, can you be a patient here? Mm-hmm. And then what kind of patient you should be here. Because over the years I transitioned from just being a chiropractor to the last few years I have a specialty degree, a diplomate degree in nutrition. So we do a lot of combination and functional medicine now. So we're looking at what can we do to fix your health all the way around. Is it diet, lifestyle changes, improving your sleep, improving your exercises, getting adjusted, taking some nutritional supplements. We'll test people for deficiencies. Our number one deficiency is vitamin D. And people don't know.
Right.
But one of the signs of low vitamin D could be a headache, muscle pain, joint pain, moving around, myalgia pain, like my elbow hurts today, my neck hurts tomorrow, my knees hurt. Especially in women, it shows up a lot that way. So we really look at how are we going to determine what brought you here, and then we'll determine what pieces will fix you.
Right.
And it's often a combination of things, looking at your diet, your lifestyle, your chiropractic. We seen somebody the other day suffers from headaches, but when we really delved into it, it's her pillow. You know, she's sleeping on too high of a pillow. So she's creating stress in her neck all night long, 7 to 8 hours of sleep, and you're stressing your neck. So we talked about some exercises to change her biomechanics of how she sleeps, got her a new pillow, and her headaches are better in a couple of days. So, I mean, we could have adjusted her for a long time and not made a change, but if we look at all the pieces,
that
makes a big...
That's amazing. So you just said biometrics?
Biomechanics.
Biomechanics. So what does that mean?
Well, we look at just the way people sit, how their spine is aligned, and...
Oh dear, it makes me want to...
Sit up straight. And if we... One of the biggest things we talk about biomechanics is like at your computer situation. Mm-hmm. So we have desks come in one size, but people don't all come in the same size. If you're really tall or really short, you don't like your desk, or your neck doesn't like your desk, or your back doesn't like your desk. We have a lot of women that are sitting in office desk chairs that are short, especially if they're around 5 feet tall. Mm-hmm. Their feet don't touch the floor. So that type of posture all day long will stress either their neck or their low back. And then over years of working as a clerical person or at a computer, they end up with neck problems, they end up with carpal tunnel or back issues. So we're now seeing people, especially corporations, going into standing desks.
Yes.
It's perfect because you can make it as high as you want or as low as you need for that person, and then they have chairs that are adjustable. So we talk to patients that, about their work and their position at their job and how many hours do you sit and how many hours do you stand. And one of my little nuances is I say get one of those little timers and turn it on that every 15 minutes it dings or flashes a light so that makes you get up and walk or move, because we're not a really big moving society anymore.
No, we aren't. We're very sedentary.
So we create a lot of joint pains. We create a lot of these things. So we try to give people everyday functional things that they can add to their life that will make their life a little easier and a little less stressful and take care of some of their pain, because we can adjust them, but that's only a small piece of the pie.
Sure.
If they're eating
you're really
foods that are inflammatory, so we have all these people come in with arthritis and joint pain and knee pain and back pain and neck pain. But if you're eating cookies and coffee and drinking alcohol and pies and lots of things that create inflammation, we're just feeding that cycle, and you can get adjusted forever and it's not going to stop the cycle. So we look at how much water you're eating. Are you getting enough greens? Are you getting more fruits? Are you getting enough vegetables? And try to cut out. I'm not saying you can never eat anything sweet or tasty, but if you're drinking a pot of coffee a day, you're probably dehydrating yourself. And that's when I ask people, I asked a gentleman the other day, how much coffee you drink? He said, well, do you want to know in cups or how big my cup is? His cup was 30 ounces. He was filling it up and he had 2 30-ounce cups of coffee a day. So he's, in reality, when he fills out the paperwork, it's 2 cups of coffee a day, but they're not 8-ounce cups.
Right.
So we really try to delve into where is the problem. And we're really dehydrated. So people's joints hurt because they need fluid in the joint to make the joint move.
So
they don't drink enough water. So we ask those questions, and then we try. And drinking more water doesn't cost anything.
It doesn't.
You don't have to buy it in a bottle.
Yeah, exactly.
So we try and give people common sense tips, things that are going to make their life easier and make it more functional. And that's where the functional medicine part comes in. It's like really. We cannot treat just pieces, and unfortunately our healthcare system is, you're old, you see a gerontologist, you're young, you see a pediatrician, you got acne, you see a dermatologist. We really don't have very many people that practice full medicine, and when you do, unfortunately insurance says you got 8.5 minutes for this patient.
Yes.
That's just the way it's evolved, I
don't know where we got off the
track.
The track somewhere.
That's what we offer that's really different.
You were about to say something about blue. Did you say, you were saying something, is it insurances or?
Well, insurance kind of mandates, the whole program is mandated by what insurance is going to pay. So, we do accept insurance for the chiropractic end of it, but when we do the nutritional end, it's all a cash pay service. But we spent an hour minimum with every new patient for nutrition, because it takes that long to take a really thorough history and then do a physical examination and look at somebody from top to bottom. And there's just so many things you can learn about looking at people's skin and looking in their mouth and looking in their ears. And if we go back to that basic diagnostic, when we look at the simple things we see, the mouth and the tongue has so much information. You can see if somebody has a B vitamin deficiency by looking in their oral cavity. And and maybe you don't need Lexapro. Maybe you just need more B vitamins and a little sunlight and a little vitamin D and some exercise. I'm not saying there's not a place for those medicines, but a lot of times we just need the basics. We need the roots. And if we don't feed the roots, the body doesn't grow.
Wow, that's a great analogy, because you're absolutely correct. And I think that, we talked a lot, and I think, as citizens of America, we always say, we've got sort of healthcare backward, because we're treating the disease instead of the root cause of what has happened and why. And so when you go back to some of the more holistic reasons for why people are, I find that, and don't you see that sometimes whether diseases, if you will, come in spurts or waves, because it seems now, for example, particularly among women, so many people are diagnosed with fibromyalgia, and yet they really can't tell you what.
I wrote my thesis in college on fibromyalgia. And it's so, I'm not saying that diet and nutrition is the primary cure for fibromyalgia, but it certainly makes a big difference in it. And patients with fibromyalgia often have multiple deficiencies of minerals, and magnesium being one of those.
Right.
So we look at how can we take this before it becomes a disease and fix it. And if it is a disease, how can we reverse it? And many things are reversible, but we kind of think once we got it, we have to stay there.
Right, and I think we clearly can, I probably have to stay a little bit neutral because we have all sorts of chamber members, but the reality is that I think that perhaps the best advice that people can give is to think about, are you really looking at yourself in terms of the way you should be looking at yourself, your wellness, your, like you just said, your diet, your exercise. We tend to be a nation that wants to pop a pill,
exactly,
and feel better tomorrow, and that doesn't always work. And yet, honestly, great strides in medicine for many things.
It's a wonderful. We need all of us. That's
yes,
my theory.
Exactly.
I always say, if I get run over by a bus, you need to take me to the ER. But how am I going to heal? I'm going to eat the right foods, and I'm going to learn to do the exercise. I'll go through the therapy, but there's a place for all of us, and I think we have to put nutrition and common sense back into the wellness plan and not throw it out. The old saying, throw out the baby with the bathwater kind of thing. We can't.
Don't you think, though, that there is a lot more interest today on health and wellness? And I know we're getting the high sign that our time is just about up, but I want to ask this question because I think it's a good thing that we are hearing more about whether it's organics, whether it's about using vitamins and minerals to look at that. That is, I will share that years and years ago, my mother got very involved with, I will say, holistic. In a holistic manner, was very, very knowledgeable on vitamins and and minerals, and it was really, she was a little bit before her time, I guess, and but now I think it's people are seeing this as kind of this is very
it's here to stay.
It's here to stay, and it's important, and it will make us feel better.
I don't know. I think one of the biggest misnomers is we have to get out there is you have to have educated people giving you the information you want. And unfortunately, there's not a lot of legislation or governing over who provides what information. And what I tell our patients is we test, we don't guess. There's all kinds of services out there, and everybody has some success, but that's like playing Russian roulette. So people say, well, if a little vitamin D is good, a lot's better, and all these.
And not so much.
Yes, and that's not true.
That's not true.
But we really like to. What we do in our office is we test every patient. We want to know where you're at, what's broken. We check your blood. We'll look at your urine. We'll look at hormones, but depending on what brought somebody in, we'll make a plan. Where do we start? So you could take that same blood work and take it to your family doctor, take it to your gynecologist, and they're going to know what it means versus something that's a little more esoteric, and there's things that are out there, So I just tell people, be buyer beware what you're buying, and make sure you have somebody that's truly educated. And when you're buying medical stuff, you don't want their education to come from the internet or. And honestly, it's there. I mean, I open the internet and use it like everybody else does, and there's all these services. You can become a nutritional coach. You could become a this. You could become a that. And all you have to do is pay your $5.99, and you'll get your certificate in the mail after you do some. And then somebody will hang out a shingle. I mean, that's going to change in years to come, as did many other things in the past. But buyer beware when you're doing that, so that you don't get hurt or you don't make a bad choice or put good money after bad buying something that's not really validated. Make sure the science is behind whatever you do.
I love that. Make sure the science is behind what you do. Well, our time is going so quickly because it's just fascinating. I have a lot more questions. So we'll have to have you back, Dr. Kulp.
That's great.
Because this is really interesting, and I think it's really important for people. We are all stressed to the limit. I think that is, I can say that pretty assuredly, that most people today are working harder, maybe not smarter, because we're working too hard. And so therefore we have to take care of our bodies, because that is the first thing that will show the stress and the breakdown, and then other diseases that come of it. So I would like to thank you. I would love to thank you for all your years of membership in the Chamber, and how dedicated you've been, and very involved. So again, thank you so much, Dr.
Well, thank you
Kulp,
for having
being.
me. Thank you, Karen.
Been
It was great.
wonderful.
Thank you.